This is Think Out Loud on OPB. I'm Dave Miller. The nonprofit La Clinica has been working to meet the health needs of low-income residents in Jackson County for nearly 40 years. One of its tools is a mobile health clinic, a 38-foot-long custom-built Winnebago that just started operating in February. It's actually the nonprofit's third mobile clinic, a replacement for the last one, which was destroyed 3 years ago by arson. Zulma Larios is La Clinica's field-based care manager. She joins us now. It's great to have you on Think Out Loud.
Thank you for having me, Dave.
What is the big idea behind a mobile health center?
Yeah, I think mobile health center, even more, I think the last 5 years, ever since COVID hit, I think it really started taking off. It's been a part of healthcare for many, many years, but really that sense of understanding that folks are at different places in their life and they have various barriers, traumas, experiences that sometimes prevent them from going into brick and mortar clinics. And so our mobile health clinic, any mobile health clinic, I think has the goal of going to where people are at and providing access to care that they typically would not have access to.
Where does this clinic go?
It goes all over the place. This new clinic, we're out Tuesday through Saturday. That's one of the things that we shifted was bringing in more hours that are more accessible to our community. And so we've added Saturdays and later days. We go to 2 sites a day all over Jackson County, really trying to create various access points. And throughout the month, we partner with other organizations to try to go out to some of the more rural areas that really have no access to care. We partner with locations like shelters. There's various housing sites that we go to. We try to be present when there's community events to make sure that folks know about us and get to know our team and see our face. That really supports building the trust with these communities.
Is it a regular schedule so someone knows on Wednesdays at 2 p.m., there's a good chance that the mobile clinic is going to be here?
A little bit of yes and no. We do have a consistent schedule for the most part for the week. We have a couple of days that are rotational days. So we go to different sites. We're really trying to create as much access as we can. Right now, because of just some of the things that have been going on in our country, we understand that there's some fear for some folks. And so there are some sites that we are not marketing as widely online. And so we have some sites that we share with community partners and rotate more just to create more opportunities for the community to come to places that aren't so scheduled.
I want to hear more about that as we go. But first, can you give us a sense for the kinds of services that people can get in this Winnebago?
Yeah, pretty much anything that you could get in a clinic, you could get in this mobile health clinic. We offer basic health care. We've got sexual and reproductive health. We care for chronic illness, immunizations. We even have a little lab testing station where we do point of care, where we can do comprehensive metabolic panels, A1Cs, sexual transmitted infection disease testing, and we get those results in minutes because we know oftentimes the communities we serve, we might not see tomorrow, or we don't know when the next time will be that we will see them. So we've got a little lab area for that.
That's actually, I have to say, just to step in, I mean, as probably most people listening have experienced, if you go to a clinic to get lab tests or, as part of a primary care checkup, it could be a day or more before you get your results. You're saying in this van, you can get them within minutes?
Yes, with some of the machines that we have available to us, we're able to get results right away.
What about dental care?
We also offer urgent dental care. So I'm partnering with our dental clinics at La Clinica. Right now, we're able to provide about 4 hours a week of dental care that we hope will expand as it is utilized more and more by the community. But we do have our mobile health clinic has one medical exam room and then a second one that works as a medical and a dental room. So depending on what we're offering, we can use it for either.
What are the reasons that people might seek out your mobile clinic now as opposed to a brick and mortar clinic?
I think there's, so many reasons. I think oftentimes the communities that we serve have had negative experiences, not just in clinics, but in other offices. And so there's that trauma of going into brick and mortar clinics. There's fear of judgment for whatever their story is. Sometimes things are a little bit more structured, and depending on where someone is in their life, they might not know what they're doing the next hour or tomorrow or next week. And so having that availability of them just being able to walk in. And then I think just some of the things going on, in our nation around immigration, there's fear for folks to come into clinics, uncertainty around processes, with all the Medicaid, like possible data sharing, things like that, that create a lot of uncertainty and fear. And so that's part of what our team does is really supports in educating when we can, and then making sure that folks know all that is available, but also the consequences of getting care so that they can make the best decision for themselves.
Have you seen a drop in people visiting the brick and mortar clinic from either undocumented or immigrant communities in the last year and a half?
I mean, I think so. I think that there is definitely fear and uncertainty that is keeping people from coming in, even when they really need care. And I don't, work with the hospital systems, but just being as connected as I am to the communities, I do know that there are folks that are not going in for care until like they really have no other choice. And that's sad because as a healthcare leader, I think that we know early care can change everything. And so when people wait, conditions get worse, and that impacts not just individuals, but the entire family. So that is, I think, what I love about mobile health in general is that it provides an opportunity for folks to get the care that they need, and then be connected with someone that can walk them through getting additional care if we can't support them with whatever it is that they need in our mobile clinic.
How do you actually address those concerns? If people are afraid to go to a clinic because of fears, say, that their information could then be turned over to the feds, what do you say? And how do you get them to feel comfortable going to the mobile clinic?
I think that one of the things that we do really great in general, but really in our mobile clinic, is that we try to give the option and the decision to the patient, and really empower them to know that it is their decision. So all we can really do is provide the information that we have. So as we are getting updates about what is going on the federal level, then we can share that with our patients, and then they can make the decision. But also, we've got our sliding scale. So if someone decides, what, I'm not going to apply for Medicaid right now because I have uncertainty or fear of doing this, then they can use our sliding scale if they qualify based on their income. And so they have options. We try to give options so that they can make the best decision for themselves. But again, we really here's all the information that we have for you. And then if you have questions, we'll answer them. But really the decision is theirs. We are not pushing them or pressuring them to do what could have consequences for them.
I'm talking right now with Zulma Larios, field-based care manager at La Clinica. It's a Jackson County nonprofit healthcare provider. I understand from your recent press release that another group that you're trying to reach through this mobile clinic is people who have been involved in the criminal justice system. What does that look like?
Yeah, we've partnered with organizations such as our local transition center here. There's other organizations that have created hubs for those that have recently been involved in the criminal justice system. Again, it's part of that trauma of feeling judged, of shame, of just uncertainty, of re-engaging back with society. And so creating a space for them to be able to take care of themselves and hopefully help them create capacity and like renewed skills to be able to engage with not just healthcare, but all the various things that they need to survive in life.
La Clinica, your organization, launched its first mobile health center back in 2011, and that lasted for about a dozen years. And then you had a second one, which started in May of 2023, but that was destroyed just 3 days later because of arson. What was that day like for the organization?
Oh gosh, it was devastating. We were very excited about this new mobile, our first one that actually launched in 2012, February 2012. had provided so much for our community, and it just had so many repairs that needed to happen. And so through a federal grant, we were able to get a new mobile health clinic that we planned for at least a year and a half. And yeah, it got destroyed 3 days after we had provided services. And it was a really sad day, but also full of hope and heart to see our team not judge the person that had done this and understand that, gosh, this is because of all of the lack of resources for mental health, substance use that are lacking in our communities, and really not put shame or guilt on this person, but instead say, gosh, I understand, and it's just going to drive us to continue to provide services. And so we actually sent them home that day and said, go take care of yourselves. This was a hard thing. And they all went to our community sites instead of go home to say, we're still here. We're still going to provide care. How can we connect you? Which was, I guess, the best way in such a horrible experience to see how the heart is there for our team. And that is why we're, I think, successful in what we do.
What has it been like to be back in the community with this clinic on wheels after that absence of close to 3 years?
It's been beautiful. I mean, our community partners have just welcomed us with open arms. They've shared the gap that they have seen. And we see it when we go and we see patients that, haven't refilled their medications for a year, that have had wounds for so long that they haven't taken care of, patients that just have so much going on that maybe even were already established but hadn't been able to make it into one of our clinics. And so being there, like when they need us in the moment, like come and see us, has been, I think, so essential, especially with, I think of like dental and how hard it is to get in to see a provider right now. Having that resource for our community is great. And just the navigation of our system. Sometimes it's challenging for those of us that have some experience with our systems or have the capacity to do those things. Sometimes even for us, it's challenging to get appointments and to fill out all the paperwork and understand what the processes are. So I think having someone that really can walk folks through that and support them in getting in with the least barriers possible, I think is such an essential thing. And the other thing I really appreciate about our teams is that they go beyond healthcare, although we see these things as healthcare too, social determinants of health. And sometimes that is the priority for patients. And I think that sometimes in clinics that is not understood, where a patient might have a priority of food, housing, transportation, something with their children, that unless that is addressed, they have no capacity to care for their health. And so our team has community resource specialists that are community health workers that can address those things and help build some capacity so then the patient come and can take care of their health. And so I think that's a beautiful thing, that the patients can get all of these various services. They're not going to get any less than if they were in a clinic. We're going to provide the same quality and the same wraparound services.
What have you heard from patients who've gotten help through this mobile clinic in the last couple months?
I mean, so much gratitude, appreciation that we're there for them, that we're in all of these various locations. The comments that we get from patients are just so heartwarming, how they feel heard, they feel connected to our team. We've got a bilingual, bicultural team. A majority of our team is bilingual, bicultural. And so we've gotten comments of like how cool it is to get care that feels culturally appropriate in their language. And just, I mean, that's the cool thing about our mobile, is that we do have like 30-minute appointments, but if we only have 2 patients today, then we're going to utilize the whole time to spend with them and take care of all of their needs. And so there's flexibility in how we care for each individual. We always have a goal to try to get them into a primary care clinic if possible, but understanding that not everyone's there and might not be there. And so we'll hold them as long as we need to.
We have just about 30 seconds left, but what happens if people don't have insurance?
We won't turn anyone away for not having insurance. We work off of a sliding scale. So depending on their income and housing status, that can be reduced all the way down to 0. But depending on their income, they might fall within a sliding scale.
Zulma, thanks very much.
Yeah, thank you so much.
Zulma Larios is the field-based care manager at the Jackson County nonprofit healthcare provider La Clinica. They recently debuted their new mobile health clinic. It is a large, refurbished Winnebago. We end today with a follow-up to Monday's conversation about the Oregon Donkey Sanctuary. I called it Oregon's only donkey sanctuary. It turns out I was wrong.
My name is Susie, and I love the Oregon Donkey Sanctuary, but they are not the only donkey sanctuary in Oregon. We are in Mosier, and we have a donkey sanctuary called Little Nuggets Donkey Sanctuary. Please check us out at littlenuggetsdonkeysanctuary.com or on Facebook, and that's a donkey in the background. There you go.
Susie, my apologies, and thanks for the call. Donkeys are lucky to need help if they are in the state of Oregon. Tomorrow, we're going to be talking about the Trump administration. They announced a massive reorganization of the U.S. Forest Service last week. The headquarters will move from Washington, D.C. to Salt Lake City. Several regional offices and research stations will close, including one in Oregon. We'll hear what these changes could mean for public lands. If you don't want to miss any of our shows, you can listen wherever you get your podcasts. Our nightly rebroadcast is at 8 p.m. Our production staff includes Malia Fass, Rolly Hernandez, Gemma DiCarlo, senior producer Allison Frost, and managing producer Shiraz Sadiq. Nalene Silva and Layla Isbell engineer the show from the Gert Boyle studio. Our technical director is Stephen Cray, and our executive producer is Sage Van Wing. Thanks so much for tuning in to Think Out Loud on OPB and KLCC. I'm Dave Miller. Have a great day.
Support for Think Out Loud provided by Steve and Jan Oliva, the Rosie Tucker Charitable Trust, Michael, Kristen, Andrew Kern, and Anna Sanford, Kevin and Amy Constam Family Fund.